firstly, thank you, Honorable MP Sir, for giving us time. Honorable MLA Sir, this exercise I remember started last year, and Joint Director and Rahul had come saying, Power Grid wants to give itna paisa, will we be able to absorb? And that's how this program was structured. So many hands have joined to make this a reality. Of course, Mr. Paul from Silchar felt the need to also donate largely. I would also acknowledge Superintendent Dr. Rajat, obviously always leading, Bashir, Chandan, specifically who were working for the success of the ICU. And most importantly, sir, since it's also my one of the last few days, I'd like to acknowledge each one of their contribution today, because we've seen COVID together, flood together. Health is something that is always going to be an issue, and we will always need people's help. So firstly, starting with Principal Saab, Superintendent Saab, when I first just joined from Hailakandi, fully knowing that SFCH is going to be the field of action for the entire valley, we started from very little, and with government support, APA leadership and their initiative, we could really put up a strong fight. There will always be naysayers who will say something could have been done more. That is the pursuit, but we really did our best, and 24/7 it was always about how to improve services. And I must thank, usually medical colleges are credited with principals and superintendents who are not taking initiative, but Kachar in that sense is lucky, and Barak Valley is in that sense very lucky. And of course, I hope to work with you in other capacities also. Superintendent has been, somehow her entry has brought in good days to civil hospitals. Very soft spoken, very quietly, then gets her work with sincerity done. Also, Dr. Hazari, who was the ex-superintendent, we fought COVID when he was the HR superintendent, and we tried to do as much as we can. Dr. Rajat, Dr. Joey, truly the young guns who are asset to the civil hospital, who are also sort of setting up cleaner systems in their own way. Ujjal from NHM, who's been working. Bashir is truly then like a passionate worker in the blood bank. Really is very passionate about the subject, sir. We've written to government for a plasma separator. If that can be brought, we can actually cover many more patients, since it's very specific to the requirement of the patient. Civil hospital staff, we have Dr. Suren Singh here, Sonai BPM also. COVID, vaccination, always heavy targets. Sonai has a lot of issues also. Dr. Vinayak from UNICEF, sir, been a third-party observer, supports to all of our endeavors. Very active, very hands-on, understands the politics of the place, tries to get the work done. So thank you. Dr. Ali, sir, he was our district surveillance officer. We brought him actually because our DSO was not enough. And again, very thorough, very meticulous, very committed. Even at his peak COVID time, when he was down with COVID, every night there is Dr. Ali's message कि मैडम आज इतने टेस्ट हुआ, इतना केसेस हुआ. We were not prepared to manage the big data of COVID, sir. He and the IDSP team really laptops leke they weave this magic to ensure maximum outreach. Zakir as our drugstore manager. Somehow Kachar experience has been very much to do with health one way or the other. He's also been very, very sincere, again an asset to the team. Chandan for instrumentation and engineering equipments. अकेला है जो पूरा जिले का health equipments देखता है. He's very committed, again very sincere. Dr. Roy, we let go of Karimganj to stay back with us. Vijit, who's been with us in Piramal, his biggest contribution would be at the ISBT centers. People were pouring in, and to manage them with no systems, nothing available, and most importantly, the COVID का जो भय था, but still to interact with anybody who's coming from outside and getting it into systems, even though he was not core administrative member. Thank you, Abhijay, for all your services. I see Harinagar BPM, again extremely committed, sir, and Harinagar is one of our best performing blocks. We're very proud of him. Dholai BPM, I see. Thank you for your good services. Adupuna se, kya naam ki mon? Deepak, sorry, Deepak. Again, these are all core DPMU teams members, sir. and they've really forgetting their families, forgetting their emergencies, have really put up a show. And I'm very proud of the way Civil Hospital managed in especially this flood time. When medical college was cut off, dead bodies were being deposited here, people had taken camping here. Iqbal bhi sir, RBSK, with the children and their help in the schools and managing that. Family planning ka kahan hai? Yeah, again dedicated. Team is good, sir. They need some direction and motivation, but the team is good. And I'm sure under your leadership, they'll grow to much more bigger heights. Since we are coming as a circle, I'd also then thank Honorable MLA Silchar. Phenomenal support. Aapne flood, you led it from the front. You got into the water, you got into distribution, you got into planning, you got into scheduling. Thank you very much. It's, I think, almost been a year, slightly more than a year of working with you. Thank you for all the support. Headquarter MLA always becomes very important to the DC because the entire establishment rotates around that. Thank you so much for being such a support system. It is easier to do work when the team is mobilized and you are a core part of that team. Thank you very much, MLA sir. And Honorable MP, I had first met him when I had just come from Hailakandi. And he said, whatever you feel is right for COVID, go ahead, I'm here. And that's how he's been constantly tracking, guiding, supporting. And what a journey it's been. We've overcome so much, so many issues. One tends to question administration always. But with some support to say, you do what is right and we'll stand by you without even getting into the details, is really the mark of a true leader. Thank you very much, sir, for all your support. And it's been an honor to work with all of you. Thank you.